Good evening and welcome to the COVID-19 update on Channels Television. I am Kayode Okikiolu. Here are some of the highlights. President Buhari encourages increased local content production and patronage as key to helping Nigeria shake off the adverse economic effects of COVID-19. Health workers threaten industrial action over unpaid COVID-19 hazard allowance. And countries around the world record resurgence of COVID-19, the United States being the latest to record highest daily cases since May. Thank you for joining us on the program. Well, for the first time in almost 3 months, no life was lost to COVID-19 in a 24-hour period in Nigeria. Well, that's according to the latest figures from the NCDC. The last time Nigeria recorded no fatality was May the 23rd, when NCDC reported 265 new cases and 167 discharges. The total confirmed cases have now climbed to 47,743 as 453 samples came back positive across the laboratories in the country. 334 new discharges mean that almost 34,000 people have now been discharged nationwide, while the fatalities remain unchanged at 956. A breakdown of the latest numbers shows 15 states and the FCT account for the 453 cases. Lagos with 113, FCT with 72, Plateau with 59, Enugu 55, Kaduna 38, Ondo 32, Osun 26, Ebonyi 20, Ogun 9, Delta 8, Borno 7, Akwa Ibom 6, Oyo 5, Bauchi, Kano and Ekiti 1 apiece. The NCDC also announced the inclusion of the General Hospital Onitsha, Anambra State to the NCDC Molecular Laboratory Network, bringing to 63 the total number of laboratories with the capacity to test for COVID-19 in the NCDC lab network. Just as most countries continue to devise ways of adjusting to the new normal created by the COVID-19 pandemic, Nigeria's President Muhammadu Buhari believes that one quick way to revive the economy is by patronizing local entrepreneurs. Speaking from Abuja virtually to a large audience at Yenagoa, Bayelsa State during the commissioning of the Nigerian Content Development and Monitoring Board building, the President explained that he has given priority to local content development policy. He explained that this is the focus of the recently signed Economic Sustainability Plan worth 2.3 trillion naira.
This commissioning brings to the fore the importance of local content in all activities of our national life, especially with the prevailing COVID-19 pandemic. I believe strongly in local production and patronage of our goods and services as one of the surest ways to empower our citizens and give them viable opportunities to excel in their chosen professions and business endeavors. That is why 2 of the executive orders issued under our government are related to enforce local content in public procurement and contracts to further replicate the successes being realized in the oil and gas industry. Local content and self-reliance are the key principles of the recently approved 2.3 trillion naira National Economic Sustainability Plan.
Well, COVID-19 has changed so much about the way we live, particularly our parents. Now, one is not considered fully dressed without a face mask. Well, to commemorate that new addition to our lifestyle, people around the world are marking the World Mask Week with various activities to raise awareness on the need to wear a face mask. In the nation's capital, Abuja, the Managing Director of CAS Consult Limited, Mr. Ademola Kasumu, is asking Nigerians to imbibe the culture of using face masks, which is currently one of the non-pharmaceutical measures for protecting oneself and stopping the spread of coronavirus. He also marked the day by distributing face masks to schools that are preparing students for their exit classes examinations.
In commemoration of the World Mask Week, we appreciate the President of the Federal Republic of Nigeria, President Muhammadu Buhari, GCFR, the Presidential Task Force on COVID-19, the NCDC, and NAFDAC for their tireless effort to defeat this common enemy. CAS Consult is today introducing a formidable weapon to fight COVID-19, and the weapon is love. By making sure that your next neighbor is protected, by donating to the vulnerables and the less privileged, and by also protecting yourself. We firmly believe that this is the best way to curb the spread of the virus. This is what inspired our decision to choose schools for this distribution of CAS 3-in-1 complete protection.
The most important advice for our students is to maintain good hand and respiratory hygiene in order to remain safe. They should be advised to always wash their hands at all times, break, lunch, and all after-school activities.
Well, here in Lagos, students in state-owned schools may be promoted to the next level with their continuous assessment test. This is coming from the Commissioner for Education, Mrs. Folashade Adefisayo, who told Channels Television that the state government is communicating with the federal government to determine steps that will be taken in terms of school resumption.
The reopening we're doing is actually, we're working with the federal government. And so and with all state commissioners. So I would not unilaterally like to say we are doing this or that, but we are planning. And if we do not, there are two different scenarios. We don't scrap third term, they come into third term, but that means that we push next session to next year. So again, each one has its own complexities, and just be assured that we will do what is best for the students. One thing we're certain of is that if we do not do the third term exams, they will use their CA. Remember, it was second term. This thing started in second term. So they have CA and exams for first term. They have CA for second term up to a point. And when they come in, we can actually have a kind of baseline assessment for all of them. And that's what we would do in our schools. In the public schools, we're going to have a baseline assessment, determine where they are before we promote them to the next class. And while I cannot give definite dates for now, I'm certain that we're going to keep on opening a bit more each time.
Well, Yinka Oduwole joins us this evening on the program. She is a pharmacist, and we'll discuss some of the new trends in Nigeria's battle against COVID-19. Well, good evening. Thank you for joining us on the program.
Thank you, Cody.
Well, I mean, we began by talking about Nigeria's fatalities. In the past 24 hours, we didn't record any fatality. And when you look at our case fatality ratio, for example, you see we're at 2%, which is lower than the global average. And for a lot of people, they're wondering, do we have any secret treatment or any drug? How are we getting this right to an extent?
I must commend the government for the actions on the use of masks and the other non-pharmaceutical measures to prevent the spread of this virus. I must say that that's one of the major reasons why we have not recorded fatalities, and that's why our cases are being reduced. And I feel that people should do more of this than waiting for the cure.
You know, the question a lot of people ask is, I mean, they look at people that say they tested positive, and a few weeks after, they test negative, and they wonder, we don't have a vaccine. I mean, there's no drug per se for COVID-19 that is generally approved. And they always want to ask, how did this happen? What process did they go through? Which is why I ask, do we have any form of secret treatment that we're using?
Actually, you know, when people get tested, and even though they are not symptomatic, when they present themselves at any healthcare facilities, they usually advise them to either self-isolate such that they won't spread the virus to other people. So I think that's one of the most preventive measures. Once this virus is not being spread to others, that will kind of curtail the virus. Then even when they present with symptoms, At the various isolation centers, they are usually being treated symptomatically, such that as the symptoms comes, they combat it with the necessary drug. And that is usually under supervision of healthcare practitioners and not just to self-medicate.
Which I think you're going into that, debate about what to do, what not to do, especially because a lot of people are thinking, maybe I should go to this pharmacy and get this drug. Maybe it might work. What are the drugs that you can actually get, and what are those ones you should stay away from?
Actually, there is this survival instinct in people to kind of self-medicate because they want to get well. But even from WHO, it says that we can only self-medicate responsibly, and that is the use of over-the-counter drugs. What are these over-the-counter drugs? These are drugs that can be gotten from pharmacies, like you said, that without a prescription. So we can only self-medicate with such drugs, and these are where the vitamin C's of this world, the supplements that we use are. They fall under the over-the-counter drugs. So we can only self-medicate. But any other drugs that are prescription drugs should be strictly under the supervision of a healthcare provider and not be self-medicated.
So safety is the watchword here.
Yes.
Well, I'd like to thank you so much, Yinka Oduwole, pharmacist. Thank you for sharing your thoughts with us this evening.
Thank you for having me on the program once again.
Let's head over to the nation's capital, Abuja, where the Presidential Task Force on COVID-19 briefing took a different format today, as the PTF chairman and secretary to the government of the Federation, Mr. Boss Mustafa, began by welcoming the Foreign Affairs Minister, Jeffrey Onyema, who just recovered from COVID-19. The PTF also appealed to Nigerians not to lower their guards with the low cases of COVID-19 recorded in the past 2 weeks. Well, in commemoration of the International Youth Day, the SGF thanked young Nigerians who have stepped out to join in the fight against COVID-19 while encouraging others to join in the fight. The United States gift of 200 ventilators was also appreciated, just as it promised judicious deployment and management of the equipment.
Rather late, so we'll speed this up.
Let me take this very precious moment to truly welcome our colleague and our friend, the Honorable Minister of Foreign Affairs, Mr. Godfrey Onyema, back into the fold, and to truly say how grateful we are to God for sparing him in the midst of the ravaging and virulent effect of COVID-19. His story is a clear depiction of the fact that COVID-19 is no respecter of persons, of office, of status, of creed, or of anybody. The country has effectively entered the second week of the extended ease lockdown phase, and the Presidential Task Force continues to monitor global and national trends in the response to COVID-19 pandemic. Globally, the world continues to pursue the search for a vaccine, with over 1,000 trials ongoing and different claims of level of success. We note particularly the announcement by the President of Russia on the breakthrough in the development of a vaccine, even as we study the developments. Fighting the pandemic successfully will take a global effort, and Nigeria will not be left out whenever and wherever progress is made. However, the health and safety of Nigerians will always remain our priority in the pursuit of a solution. For us in Nigeria, we shall focus on propagating the use of proven avoidance methods to break the transmission of the virus and effective case management to care for and treat infected persons.
We take a break now on the program, and when we return, we'll bring you news from the United States as the nation battles a resurgence of COVID-19. You're welcome back. Health workers are vital to winning the war against COVID-19 the world over, and it's never pleasant to hear the possibility of an industrial strike, not to talk of an actual action. Well, here in Nigeria, the leadership of the Medical and Health Workers Union insists that there is no going back on their planned industrial action if the federal government fails to include its members in the third phase of payment of the special hazard allowance for health workers. Addressing journalists on the sideline of a meeting with members of the union in Abuja, the president of the union insists that although the union will keep the doors of negotiations open, it will not continue to tolerate discrimination against its members.
Certainly, we are service-oriented. We are trained to give service. But the first principle of giving service should be that you should be alive, you should be well cared for, to be able to give what you are given. We entered into agreement with the Federal Ministry of Health, where the Federal Ministry of Health also agreed that there was error in the implementation of the COVID-19 allowances. People who are earning 5,000 that ought to have been prepared on 50% were given 10%. And we, in our traditional way, we didn't immediately rush on to strike. We engaged government, and government has seen that reason. We are believing that, and we hope they will do so. Before they pay the third batch, that correction would be made. Thank God the press is here. I want to make a very bright appeal to Nigeria, the Federal Ministry of Health, as well as the Nigerian government. Do not lead us into temptation. We have been patient. That does not mean we are weak. What we are saying is treat us properly, so we can also dispense proper treatment to our citizenry. I am not going to close the door on dialogue, but dialogue cannot be inexhaustive. But where we begin to see that they now ignite our appetite to distrust government, we will not hesitate to distrust, and then that will be the signal for war.
Solomon Cholum, a medical virologist, joins us from Jos this evening. Well, thank you for joining us on the program. Well, let me begin by getting your reactions, really, to that statement from the health unions about an impending strike action. What are your thoughts on that?
Some of the things that I find very, discouraging, discussing issues of welfare, especially in this period. I prefer to talk about science, I prefer to talk about intentions. But as it is now, I will just appeal to the federal government to do the needful and honor whatever resolution they have entered.
Right. So let's now talk about science now. You know, Nigeria's Foreign Affairs Minister just recovered from COVID-19. He said he wore his face mask, his face shield, even air purifier was on him most of the time, and yet he got the virus. I mean, this is one sneaky virus, isn't it?
Yeah, so the use of those protective gadgets, they are very necessary. But then, what also gives the protection is the half of the usage. Now, most times, for you to use a face mask, a face shield, and all of that, it has to be, first preceded by hand hygiene. Most times, people don't take these things, they are the basic things that make the prevention, very good. Whenever breach is instituted, using a face mask, a face that at the end of the day is already contaminated, is infected. So that exposes you. I am sure you have gone round to see people use face masks. Most of them put it, at their chin, and that itself, is a dangerous phenomenon that we must discourage.
Well, let's talk testing. I think it was in April you asked the government to expand testing. Well, we're in August now, we currently have tested over 338,000. We have not even tested 1% of Nigeria's population. So I'm wondering, right now, what would your message to the government be?
Testing is one aspect that we have performed very poorly as a country. As a mass check, Nigeria is one of the countries in Africa that is doing very bad in this sense. We have so far tested, or rather our testing ratio is like 1 in every 1,000, and that seems to be the widest as far as Africa is concerned. South Africa has done far better. They have tested, or rather they are testing at a and that in itself is a good thing. We have been able to upscale from just 5 laboratories to 63 now. But basically, we have increased what I would like to call the testing points, but we have not increased testing capacity. Most of these laboratories are not testing full capacity. So
I'm sorry, I have to come in here, Mr. Solomon Chalom. Thank you so much for sharing your thoughts with us this evening. He is a medical virologist joining us from Jos. And we sincerely apologize for that poor audio and video quality. Well, let's head outside Nigeria this evening as countries around the world are experiencing a resurgence of COVID-19 cases. And one of them is the United States. Here's more on this and other developments on our COVID-19 global update.
The number of cases in the United States is said to have exceeded a staggering 5 million, the highest in the world, with an increase of 52,839 over the past 24 hours, and a death toll of more than 165,000, according to statistics from the Center for Systems Science and Engineering at Johns Hopkins University. The U.S. has also recorded almost 1,500 more deaths linked to the coronavirus pandemic today, its biggest single-day increase in fatalities since mid-May. A top health official has warned the pandemic is the greatest public health crisis to affect the country in a century. Germany has seen a steady rise in the number of cases, raising concern among the country's policymakers, who are also concerned about hygiene rules being violated in people's private lives. Bavarian State Prime Minister Markus Söder said it is clear that holidays are a great infection risk for the country. Spain has banned smoking in public places to help curb the spread of the coronavirus. The ban on smoking on the streets and on restaurant terraces is expected to help people with maintaining social distancing. Meanwhile, thousands of students at a Belgian university will, from the month of September, collect weekly samples of their saliva for a rapid COVID-19 test, replacing more commonly used swabs in one of Europe's largest experiments with a new testing method. Around 30,000 students and academic staff at the Belgian University of Liège will use the self-test at home and take the tube with the saliva sample to the university labs every week through December. Finally, Cuba's top epidemiologist, Francisco Duran, says he expects a COVID-19 vaccine to be available worldwide from early next year, as some suspect the vaccine he's talking about could be coming from Russia, which a few days ago said it had granted approval to a vaccine less than 2 months of human testing and had yet to complete final trials.
We'll take a look at our website, channelstv.com, which has latest updates on the pandemic. All you need to do is log on and access the news in health, news, politics, business, sports, and so much more. Like this story, countries tighten rules as world coronavirus deaths pass 750,000. Well, that's the COVID-19 update. Thank you so much for watching. I am Kayode Okikiolu. Do stay safe and don't forget to wear your face mask. Good night.